Hi guys, how are you? So welcome back to my channel. If you're new here, umekaribishwa sana. My name is Mumina. I am a registered dietitian and I create content on health and nutrition. If that is something that you might be interested on, please make sure that you click that subscribe button to join the community and let's continue learning. So in this particular video, I'm going to talk about what is diabetes and the effects that it has on your life, and I'm also going to be spilling a lot of tea on my upcoming webinar. So make sure that you stay tuned. It's going to be very short but very educative as well. In a nutshell, we have three types of diabetes. We have type 1, that is basically an autoimmune disorder, and this is characterized by the inability of the body to produce insulin in enough amounts to safely self-regulate the blood sugar. Insulin is an hormone that is tasked with controlling blood sugar. And we also have type 2 diabetes, whereby it is a progressive condition that comes about due to the insensitivity of the beta cells to the insulin produced. The body might be producing enough insulin, but your beta cells in the pancreas is not able to actually identify or utilize that insulin to effectively control blood sugar. So that is type 2. And of course, we have gestational diabetes that affect pregnant women. So if you're pregnant, make sure that when you're going for your ANC, you actually ask them if they forget to actually check you on your blood sugars. And gestational diabetes is also a risk factor to type 2 diabetes. So how does diabetes affect your life? You know, when you're talking about the effects of a disease, most of us actually just think about the impact of that disease on a specific person. Of course, they are very heavy on the person because they are the person who are actually suffering with the implications of that disease. If it's uncontrolled blood sugars, they are the ones who are actually risking getting the nerve damage and other complications of uncontrolled blood sugars. If you need more in-depth analysis of the complications associated with diabetes, you need to check out this video. I talked about it a lot there. Of course, there's going to be the aspect of the psychological and the emotional stress. Anytime you're told that you have any condition, leave alone a chronic disease that requires lifelong management, you're actually stressed. If I get a flu, if I get an allergy attack, I'm usually not so happy about it. I can imagine the fear or the emotional baggage that this person who has been diagnosed with a chronic disorder actually has, and that has actually been associated with increased mental disorders like anxiety, depression, ADHD, and others in diabetes. Of course, we also have the chronic inflammation that is associated with uncontrolled blood sugar being a contributor to the increased mental health risk for diabetes. But again, the emotional and the psychological impact of being diagnosed with a condition is already enough. So if you're just living freely, you didn't actually think about what you were eating, what you were drinking, how you were sleeping, how your physical wellness was, and now your dietitian or your nutritionist tells you that you need to have these readjustments, all this can as well contribute to the emotional and the psychological burden of disease. And that is why it is actually recommended that if you struggle with acceptance, because sometimes clients refuse to agree that they have this condition. It is very common when someone is told they are diabetic, they say, no, I can't be having diabetes because maybe I'm not fat, or I can't be having diabetes because why would I have diabetes? No one in our family has diabetes. There's a lot of denial that comes in the initial phase of diagnosis, and it is actually recommended that you work with a psychologist or a therapist, or even you have deep down conversations with your nutritionist or your healthcare workers for acceptance. So that is on the individual person. What about your family? Of course, there's the aspect of the increased financial burden when it comes to healthcare, because now you are going to need frequent assessment, frequent testing, and you're going to need all these professionals. You need a physician, diabetologist, you need a dietitian, you might also need an ophthalmologist, and even a renal specialist to ensure that you are being holistically managed to prevent any complications that are associated with diabetes. And all these come at a cost, and sometimes they might actually dig deep into the family's health insurance or even health expense kitty. You might find that after your diagnosis, you might actually now be the one that is actually consuming a big percentage of this insurance cover, and this comes again with a lot of guilt. You might be feeling like you're letting your family down, but trust me, you're not letting them down. You need to be taking care of yourself, and that is why in our sessions or in our counseling sessions, we actually recommend that you come in or you join in with a partner or with your relative or your family member so that they can be able to understand why you might need to actually actualize all these changes that we actually recommend, especially when it comes to eating, sleeping, physical wellness, and stress management and such. Because again, the genetic exposure is already very evident if your family member is diagnosed with diabetes, so you cannot ignore that part. And of course, when it comes to the community and the government, what are the risks, what are the implications of a population that is sick or a population that actually has a lot of NCDs like diabetes. There's going to be need for an increased expenditure of health, and we all know how that is going. The budget we already have is already constrained, and now we are going to need a bigger percentage of that to go to NCDs, which we cannot even afford. So as a country, there's going to be like the need for increased revenue collections, and that is where increased taxation comes in. And we were on the street just the other day refusing increased taxation. So where will the government get this money? The government needs to prioritize, because now they don't have the money, or they claim that they don't have the money, or the misappropriation and corruption of these funds that are collected from the common mwananchi have actually ensured that we don't have enough to even manage our population health. So we need to ensure that we prioritize preventive and promotive health by adapting the use of qualified professionals in promotive and preventive health, like nutritionists, because community nutritionists or even clinical nutritionists come in with the education, they come in with the behavior change, they come in with population awareness. Let's say like now we have a community nutritionist in every like 10 or even 50 community health units. So once the CHPs go in with their kids and they identify someone with elevated blood sugars, these nutritionists can actually start the interventions right at the community. This will actually curtail the need to refer to the clinical setups where we are already burdened as it is. As a government, people need to ensure that they are putting platforms and measures to ensure that these nutritionists are actually at the community level when these cases are being identified and they are being mapped out, so that they can foster interventions immediately to reduce the delay that has actually been shown to be there. It's very serious between diagnosis and seeking treatment, because Kenyans only seek treatments when it's already too late, when the complications have set in. If someone is identified at pre-diabetes or insulin resistant, they can actually be reversed before they actually transition to type 2 diabetes, and this will definitely reduce on the need for healthcare expenditure. That is very important. That is why in our upcoming webinar, we're also going to talk about how to prevent the transition from pre-diabetes or insulin resistance to diabetes and such. One of the most successful intervention of preventing the transition of insulin resistance and pre-diabetes to diabetes is basically weight management. And I will be collaborating with the amazing Charity Wanyonyi from Charity Safe Haven. We also did a video with her debunking some of the common diabetes myths. I'll definitely link it so that you can have a look on what you actually expect. So we're going to go deep into effective strategies of prevention, effective strategies of management, and how to prevent the complications associated with diabetes like kidney failure, blood pressure, gout. And of course, you're going to tackle things like gut health and how it actually contributes to diabetes management and such. It will be very engaging. And of course, if you need personalized care, we are not going to leave you there. We also offer consultation, and we also have care packages. I have a 90 days reset for 5,000 Kenyan shillings for the first 50. So once the 50 is filled, now every month I'll be charging a 9,000 because of the additional work, because I might need to actually outsource professionals to ensure effectiveness and the quality of care. So you need to make sure that you check the description box on the details that I've talked about. I will be sharing them as well, and you need to make sure that you're subscribed and follow me on all my socials at Lilian Mumina and Mumina Wellness Solutions, so that you can be getting updates and real-time updates. You don't have to wait for me to give you tea. Yeah. And again, happy new year. Thank you for watching. Make sure that you check out this playlist next on blood sugar control and diabetes management, and you will learn a thing or two about diabetes. I promise you, as we await for the webinar. The webinar is going for 1,000 Kenyan shillings if you sign up before January the 30th, and 1,500 Kenyan shillings if you sign up after the 30th. This is very important to enable me to plan. So if you're interested, please, I need to start having my phone ringing. I need to start having texts coming in about how do I sign up, how can I go about this webinar and such and such. So I'll leave the details here, and thank you so much for watching. And until next time, stay subscribed.